Hello, everybody. Today I will be presenting on an 84-year-old female with acute confusion and suspected complicated urinary tract infection, and my name is Mandy Torres. This patient is an 84-year-old female who resides independently within an assisted living facility and was brought in due to a sudden onset of confusion, combativeness, and lethargy over the past 24 hours. According to the facility staff, this represents a significant deviation from her baseline mental status. Her health history is notable for interstitial cystitis, bladder pain syndrome, which may complicate assessments because chronic urinary symptoms can overlap with those seen in acute urinary tract infections. She also has a documented anaphylactic allergy to ciprofloxacin, which would influence antibiotic selection. Subjective and objective data findings include the most concerning red flag in this case is the patient's abrupt change in her mental status. Delirium in older adults should always prompt evaluation for an infection, medication effects, metabolic abnormalities, or neurological events. The patient is febrile at 100.8 degrees Fahrenheit, and she does demonstrate mild suprapubic tenderness. Although she is unable to describe urinary symptoms, her urinalysis is strongly suggestive of a bacterial infection. There's positive nitrates indicating gram-negative organisms. There's +3 leukocyte esterase suggesting purine and the microhematuria. And together, these findings significantly increase the suspicion for a complicated urinary tract infection. There is 3 differential diagnoses to be considered while assessing this patient. My primary diagnosis is a complicated urinary tract infection causing acute delirium. Older adults will frequently present with atypical symptoms such as confusion, lethargy, or behavioral changes rather than that urinary frequency or that pain. My second differential diagnosis is urosepsis. Her fever and acute mental status changes raise concern for a systemic infection. And at this time, further laboratory testing will help to determine whether the sepsis criteria is met. And then my third differential diagnosis is an acute metabolic encephalopathy secondary to infection. Infectious process commonly precipitate encephalopathy in geriatric patients, and although inflammation and metabolic mechanisms. The primary diagnosis and the rationale for it for a complicated urinary tract infection is supported by the patient's physical findings, such as her fever, her suprapubic tenderness, and the positive urinalysis findings, and again, that acute onset of the delirium. Delirium is considered a common but serious manifestation of an infection in older adults. While interstitial cystitis, like we discussed with her history, can cause chronic urinary discomfort, it wouldn't typically explain an acute cognitive decline, which then is accompanied by a fever, and that significant inflammation markers find on the urine analysis. According to the CDC and Duttel, the diagnostic plan will be multifactorial, so we'll use many different tests to determine. First, including a CBC with differential, and we're going to go ahead and do that to evaluate for leukocytosis, and we will obtain a comprehensive metabolic panel. This is going to help us assess if there's any electrolyte imbalances. We're going to take a look at the kidney function, and also we're going to be able to get a better picture of her hydration status. We're going to obtain blood cultures and urine cultures before we initiate any antibiotics, whenever that's feasible. We would also go ahead and obtain a serum lactate level, and that's important to evaluate for tissue hyperfusion and that possible sepsis that we talked about. I would also at this time obtain a chest radiographic and an ECG because delirium in older adults is also multifactorial, and additional sources of infection or any sort of cardiac abnormalities should be excluded. So we would need to get a bigger picture with those EKGs and the chest x-rays. The treatment plan is going to involve multiple different things. And because the patient is demonstrating signs of an acute infection and an altered mental status, prompt treatment is really warranted here. If I was treating this patient, I would initiate IV hydration and I would begin the cephalosporin 1 gram IV every 24 hours while we were awaiting the cultures and the sensitivity results of her labs. Cephalosporin provides broad coverage against common urinary pathogens and is appropriate given her severe ciprofloxacin allergy. I would closely monitor her mental status. We would look at her vital signs. We would definitely be taking input and output and all of her laboratory trends. We would do fall precautions, delirium precautions, and frequent reorientation and avoidance of unnecessary restraints would also be implemented. The major thing here is that we would need to follow up and make sure that all these interventions that we are trying are in fact working. Is the mental status coming back to the baseline after we've started the antibiotics? Are we making sure that she is staying hydrated enough? Following a trend to make sure that we address this before it does become the risk of her becoming septic. The social determinants of health considerations here were suggested through the National Council of Aging. A significant social determinant of health within this case is social isolation. The patient lives alone with her assisted living apartment. Her daughter resides 600 miles away. She has, unfortunately, no local family support available to assist with any of her healthcare decisions or even help assist with monitoring recovery because she is older. A lot of times you'll see family members who will know something wasn't right with my mom. We took her in. She actually had a UTI. We started treatment. She started getting back to where she was before. Things are looking good. Now, in this case, the patient doesn't have anybody to help make sure that she is getting back to her baseline and she is, in fact, recovering like she should. I would also involve case management and social work early in the hospitalization to assess for any increase in care needs and to coordinate communication with her daughter. I know as an 84-year-old woman, she may be having issues trying to get back and forth the information that her daughter needs, and a social worker can, in fact, really help with that. The social worker can also help evaluate the transportation barriers and determine whether a higher level of support is necessary following any discharge. The evidence here says this case does highlight the importance of recognizing delirium as a potential sign of infection in older adults. Prompt identification and treatment of a urinary tract infection can in fact reduce morbidity, mortality, and functional decline. According to JADAS and the Mayo Clinic, current evidence supports a comprehensive evaluation for older adults who do present with those acute cognitive changes, particularly when they're accompanied by a fever and any abnormal urinalysis findings. Red flags here, like we've talked about, especially with older adults, is that acute change in delirium. That mental status change is really something that is indicative of like there's something wrong here, there's some sort of infection marker here, So early intervention, appropriate antibiotic selection, hydration, and attention to the social determinants of health are all the critical components of successful management of this patient and her urinary tract infection. This is my presentation along with my references, and I hope you enjoyed my video. Thank you.